It is the top of the hour, and as we are already experiencing together, that this is a Zoom meeting that is an interactive discussion, not just a webinar presentation. So you have the power to unmute, and I hope you are using it wisely. Let's go ahead and move forward, Julia, please. So as you continue to introduce yourselves, let's get some housekeeping out of the way. This is just a quick disclaimer to let you know we're using public dollars for this session, but of course, HRSA does not endorse everything that's said here. We can go forward to the next slide, please. So as I mentioned, I want you to introduce yourselves in the chat box throughout. If you know the native land from which you're calling in, I encourage you to include that in your introduction. And if you need a tool to help you find that native land, I will put that in the chat box for you now. Let's go to the next slide, please, Julia. So this is a Zoom meeting. I hope that 2 years into the pandemic that most of us are quite familiar with the ins and outs, but I know that there are varying levels of competency with this technology. Something's going to go wrong. We're just going to anticipate that, and we're going to ask for grace with one another and patience as we figure that out. So our workshops today will be constructed as breakout sessions, though there's a button at the bottom of your screen that when they open, you'll find that to go into your workshops, and we'll talk about that when we get to that point. Just a heads up, there are 2 buttons that have the word leave on it when you're in a breakout session. One will get you out of the workshop itself, and the other will exit you from the entire meeting. Please be careful which button you're pressing. You should automatically be muted, but like as I mentioned, you have the power to unmute. I've got a cadre of teammates who are enthusiastic about the opportunity to mute you if you're being noisy. And that's no offense. When we get into breakout sessions, we're going to use our virtual hand raising function. You can go ahead and practice that now. If you find the reactions button at the bottom of your screen, one of those buttons says raise hand. Very cool. That will help us be organized. You can, of course, use the chat box to ask your questions during Q&A. We apologize that Zoom's automated closed captioning is not available during the breakout sessions. This is a limitation I was only just recently made aware of, and I apologize for that. We will do better next time. So our Zoom host is Brandon De La Cruz, and they can help you with some of your tech questions. Once I myself go moderate one of the workshops, just be nice because we're all figuring out how to organize a session of 1,000 people together. And we also have a number of folks who will have the term event staff in their title. When we get into breakout sessions, they will also be able to help you out. Next slide, please. If you are seeking continuing education credits, we have those for providers, nurses, and social workers. There is a link that we will provide in the chat box. It's also in the program and online. Lots of ways to find that information. Next slide, please. So I wanted to share with you some of the information you shared with us in terms of who you are. As of Monday, there were 900 something folks registered that I analyzed the data. I think this morning it's well over 1,000 at this point. But we represent not just 44 US states plus DC, but 6 non-US countries. And I don't know if you're here, but definitely from the registrant list, I saw folks from UK, Ireland, New Zealand, Iceland, Canada, and South Africa. So welcome. I think it's probably like 4 a.m. in New Zealand. So good grief. Thanks for being here. I hope you have coffee. And look at all the different kinds of organizations we have represented here. I'm noticing how I left out things like hospitals or federal government. So that's why other is so large. But we've got a great range of folks represented here. Next slide, please. And on the registration form, we asked if your community has an initiative locally to reduce unnecessary policing of people experiencing homelessness. A lot of you, the plurality of you, don't know, and so maybe that's something to take home is let's get in the know about what our communities are doing in this effort. 18% of you said it's complicated because there is a lot of nuance here. And many, about the same of yeses and nos. Great. Can we go to the next slide, please? These are some meeting norms that we use in a lot of our racial justice trainings here at the National Healthcare for the Homeless Council. But in a topic such as this that can be divisive, it can split even people of the same political persuasion, I think that they're also important for us to adhere to here. So the first one is to be present. I think we all have a more successful intentional space when we can remove distractions as much as possible. If you can close that email, I know it's a big deal, but if you can do that, that'll help you pay attention better and create a safer space together. We're going to welcome respectful disagreement because we are all adults, presumably, and disagreement is not a bad thing. We differentiate between intent and impact. We might assume positive intent, but we know that our words can have an adverse impact, even if we didn't intend for them to. We're going to pursue a safe space, even if that's a myth, even if it's not entirely possible for us to create safety in our interactions. We can respect personal experience. We can dispute people's opinions, but we can't dispute what people have gone through. Let's focus our attention on systems rather than individuals as we're talking about systemic injustice and the work that we're trying to do here. We'll monitor our identities and how much we're speaking or not speaking as we take space and make space. Let's embrace both and thinking because two opposite things can be true in any given moment. And let's encourage one another. Why not? So if this sounds good, why don't you practice again with the reactions? Give me a thumbs up or an applause, or what other emojis can you use? You have many at your disposal. Very good. Next slide, please. Why are we here? Well, I wrote about this loquaciously in the welcome letter that's in the program that hopefully you had the opportunity to take a look at. But just to quickly summarize, the acronym CAHOOT stands for Crisis Assistance Helping Out on the Streets. This is a program in Oregon that is operated by Whitebird Clinic. There might be some folks from Whitebird Clinic here. And this is an alternative response model responding to behavioral health crises that's routed through the 911 system. And it is incredibly popular, and especially since the last couple of years. They spoke at our conference last year, and it was an incredibly popular session. And we knew we wanted to do more on this work, but we also knew that this issue, this constellation of issues necessarily involves multiple different partners. And as I showed you in the previous slide, we have a lot of different kinds of organizations and industries represented here. And so we have to broaden the conversation. We all know that unsheltered homelessness is on the rise across the country, especially over the last 5 or 6 years. And the more that homelessness becomes visible, the more it becomes a political issue and intersects with public safety. We also know that laws criminalizing homelessness have also been on the rise at alarming rates. So just level setting here, criminalization of homelessness refers to laws that prohibit or restrict acts of daily survival that you necessarily have to do outdoors if you don't have a stable home. So these laws prohibit things like panhandling, sleeping in public urination, and things like that. They are discriminatory both in their intent and their impact. Remember, two different things. Many of the times they are intended to move people experiencing homelessness out of view of the public. And of course, they are almost exclusively enforced against people experiencing homelessness. I think a lot about how I have never been penalized for sleeping or lying down in a park, which I do with some regularity. So we also know that a backdrop to this conversation is the 2020 uprisings for racial justice that I do think had a global impact. But I want to remind us, one, that George Floyd is not just a symbol, he was a human being. He experienced homelessness himself. He worked for a local Salvation Army, I'm pretty sure, for a period of time. And he should not have had to die for us to wake up to the realities of systemic injustice. I also want to remind us that recent data demonstrate that we have made scarcely any progress in the last couple of years as it relates to police killings. So we should bear that in mind. So defund the police was a rallying cry of those uprisings, but we know that regardless of your stance on that, we need constructive alternatives, regardless of whether the police budgets go up or down. And so finally, why not a webinar series or an online course? Because I really value togetherness. I want us to come together to be in solidarity on our shared pursuit of solutions that truly benefit everybody. Next slide, please. So here's our agenda for today. We've got 2 blocks of workshops, each of which are 75 minutes long. As I mentioned at the beginning, we'll use breakout sessions at the bottom in order to get into those workshops, and we've got staff on hand to help with that. We'll do just 1 5-minute break in the middle. So if that does not suit your schedule, we're spanning all different time zones here. So just feel free to turn off your camera and get water, whatever you need to do. After our second block of workshops, we'll come back and do an interactive exercise where we use a program called Mentimeter to gather information from all of you in response to a particular question. And we will evaluate the thing and wrap up by 3:30 Eastern time. Does that sound like a plan? Good. Next slide, please. So I'm so glad at this point that I get to stop talking and turn it over to my boss, Bobby Watts. And I just want to acknowledge too that this event is co-hosted by the National Homelessness Law Center and the Street Medicicne Institute. And so let's hear from the leaders of those respective organizations to sort of set the stage before we get into breakouts. Bobby, take it away.
Great. Thank you so much, Michael. And thank you all for attending. I'm really looking forward to the conversation and the rich learning that will happen from hearing from each other from our different perspectives, different parts of the country, and now I learned different parts of the world. So this is really wonderful. And I also want to thank Antonia Fassinelli and Dr. Jim Withers for being part of this opening with me. And Michael gave us 3 general questions and 3 specific questions and told us to do this in 5 minutes. So I'm going to try to set the example by doing that. And I just want to say one of the reasons why this is important, this topic, today's topic is important, is because this is where our community lives, in the sense that this is among the top issues that they are facing. And by our community, I mean healthcare for the homeless programs, health centers, medical respite programs, and most importantly, though, the people that they are serving. I like to say that homelessness is a result of failures at the federal level in terms of our housing policy and other policies, but that it is felt at the local level. And we are community-based organizations, healthcare for the homeless programs, medical respite programs, and we can be a bridge between all parts of the community as it affects people experiencing homelessness. So we have a very trusted and authoritative role as healthcare providers. And I think one of the important things that we as health centers, FQHCs, healthcare for the homeless programs, medical respite programs can use is to use that trusted authoritative voice to educate parts of the community. So by that, I mean our neighbors that are housed as well as unhoused, and also the police. We all want to see the same result. We don't want to see unsheltered homelessness in our streets. We'd rather have people in shelters than, rather have people in housing than in shelters. But we have different perspectives and different knowledge. So one of the things I think is that we can do as healthcare providers is as educating the community and police. I think we just have to acknowledge that the community would probably be more willing initially to listen to us. It is said that to a hammer, the whole world is a nail. So it takes a lot to say that our way of doing things, our approach may not be the right way. But I believe if we start with the community and can show them that many of the behaviors that they find concerning and troubling are really the result of, or often are the result of medical conditions, such as substance use disorder or mental illness, or just the fact that people don't have homes. And that for the medical conditions, we have effective methods that are proven to be more effective alternatives than policing, than locking people up or sweeping encampments. We can show that we have solutions. And if we do, I think then that will also bridge so that the police will be more willing to listen. I'd like to just give 2 examples from my long career. One of them was when I was a shelter director for my former agency. We had a shelter for 107 women. And when we assumed operation of that shelter from the city of New York, We implemented what we now would call trauma-informed principles. Didn't know that at the time. We good social work practices, meeting people where they are. We cut down the security force by more than half. And the police told us that the number of times they were called to this shelter decreased by 80% over the course of the first few months and stayed that way. So when we interacted with the police at the local police precinct and offered suggestions, they were more willing to listen to us. I'd like to give one more example. Maybe 20 years ago or close to it, a good colleague, Scott Alwater of a great organization, Bronx Works, had a street outreach team. And they came to us as health providers. We were working with them on a number of projects and said, we have some extra funding. Can you find a way to provide medical services on the street? So I knew about what our colleagues had done in healthcare for the homeless programs, knew about the Street Medicicne Institute. So I'm not going to say no. I'll learn from the people who have done it. And we said yes. And as part of that consortium, within 4 years, we reduced street homelessness in the Bronx by 70%. So when we were operating a separate shelter and we were talking to the police, we had credibility. So when we can show that we use our voice to get their attention and show that we have effective solutions, we can be part of the problem. We can be part of solving the problem that we all want to solve. So I think that is an important role for police. And I think especially now when we look at the racial dynamics, we see that racism drives homelessness. It also drives certain policing practices. And by attacking these simultaneously, we can also help to change minds and practices and bring about a better, more racially just world. So I'm going to stop and turn it back to Michael. Thank you for this great opportunity and honor.
You so much, Bobby. I think Antonia is on the line. Are you ready to take it from here?
Absolutely. Thank you, Michael, and thank you, Bobby. I am Antonia Fassinelli. I'm the Executive Director of the National Homelessness Law Center, where we serve as the legal arm of the national movement to end homelessness. And it is such an honor to be with you here today. For today and always, my pronouns are she, her. In particular, I really want to emphasize and thank the National Healthcare for the Homeless Council for convening this important conversation. And it is wonderful to be here with the Street Medicicne Institute. I will tell you, I had hoped that at this point in the pandemic, we would be having a different kind of conference. I, like all of you probably, had hoped that our country's experience with the pandemic and the importance of housing in preventing spread of COVID would encourage communities across our country to finally recognize the needs and the humanity of persons without housing. I had hoped we would be saying things like, in communities, they are no longer arresting or citing persons experiencing homelessness because they now accept that those actions are cruel and inhumane. That communities now recognize that providing housing is absolutely healthcare, that housing and services are the responsibility of the community, and that when the community falls short of those resources, that punishing someone for living outside is unconstitutional. I had also hoped that therefore those communities would be redirecting funds once spent policing unhoused persons to homes, healthcare, and other services. In short, that 21% that Michael flashed on the pie chart in his slide, I had hoped, and I'm sure you all had hoped, would be a much bigger proportion of the pie. And that's our goal. And we're not there yet. We have more work to do, but together we can get there. Although we see glimmers of this shift, some brought by court action in communities that will no doubt be discussed today, we also see in some other communities a shift back to the policies of the 1990s and even earlier. New York City, the most recent example, has moved back to destroying encampments and personal belongings, still with a refusal to provide housing. And as you know, New York is far from alone. Perhaps most concerning, because it's new or we haven't seen this approach in a long time, is the rise of legislative efforts to make it easier to move people experiencing homelessness into involuntary commitments. This is a real effort to move our clocks back to reinstitutionalization. And we have seen this in states such as Georgia. There's no question that reinstitutionalization will have the same disproportionate impact on BIPOC communities as criminalization does. Groups such as the Cicero Institute are behind these legislative efforts, masking dehumanizing actions as good public policy, all in the name of so-called public safety. But let us all be clear. Institutionalizing anyone simply because they do not have a home is just jail with a fancier name. Indeed, some even on the left are masking their calls for reinstitutionalization as quote unquote compassionate care and for people who cannot help themselves. We know better. This is not compassion. If the community integrated permanent supportive housing, that would be the real compassionate care. And that kind of real investment to scale would significantly reduce the mass homelessness we have today. So let's call this what this is. This so-called quick fix that will only make things worse instead of promoting evidence-based public health and public safety solutions of adequate housing and services. And so even today, at this point in the pandemic, we must remain vigilant. That's why it's so wonderful that there's so many people here today to advocate with our neighbors without housing and demand policies that recognize their rights and their humanity. I am just one of many folks from the National Homelessness Law Center here with you today. We stand ready to respond with legal action and legislative opposition, and our approach is to do this work together. You may hear from our senior attorney, Tristia Bauman, who is speaking on a panel talking about healthcare providers serving as expert witnesses in cases challenging criminalization. You may also hear from my colleagues, Gabriela Sevilla and Erica Endres, who will be talking about policy work challenging the criminalization of youth experiencing homelessness. For those who don't know, the Law Center pursues our work decriminalizing homelessness through a national campaign. It's called Housing Not Handcuffs, which I encourage you to follow at housingnothandcuffs.org or on Twitter at the handle HNH campaign. Thank you so much. Thank you for the opportunity to be here. It's wonderful to be here together.
Thank you so much, Antonia. We really appreciate your partnership and admire your work. We're going to go straight next to Dr. Withers in Pittsburgh. You're fresh off a sailboat, I believe. Welcome back.
Happy to be back. It's a great honor. Have a lot of gratitude for you, Bobby and Michael, for pulling this together. I think this is a critical area of discussion, and whenever we get together in the spirit that you outlined of trust, mutual love for each other, I think that's how we have to proceed into a better future. The Street Medicicne Institute, many of the members are here, is a grassroots organization which has been taking shape over the last couple decades. And we are a wide variety of individuals. Many of us are Healthcare for the Homeless members who go directly under the bridges, into the alleys, along the river banks of our cities to engage people, largely initially with a medical purpose, but of course it becomes a human interaction and one of great solidarity. Solidarity and shared experience is what informs us and guides us. My participation here, I believe, is prompted partly by an article that I was asked to write by the American Medical Association Journal of Ethics entitled, How Should Street Medicine Clinicians Interact with Law Enforcement Officers? First, I was intimidated, but then I embraced it, and I thought this is really an important area that to at least break some ground on in terms of opening the discussion. I struggled to find the place where I could speak with the level of respect for those sisters and brothers on the street and the experiences that they've had, but then to also open up avenues of healing, perhaps, and dialogue. And for me, I always look at my own healthcare field as an analogous professional body to law enforcement. We are both charged and embrace the work on the street. And as such, we are intersectionally placed between many of the traditional trauma and injustices that people suffer. And our tools are limited. As you said earlier, if you have a hammer, everything becomes a nail. I find that the work on the street is a liberation of my own humanity to meet people and to not have an agenda or a box to have to put them into. I know that law enforcement and many of my colleagues in healthcare do not have that luxury. Their options are much more limited and circumscribed. And so in my article, I tried to acknowledge the challenges of structural violence that those on the street experience, but that we are also trapped in. And then to perhaps create the beginnings of a path to look at what we can do for that. I give a couple examples of instances of where things went terribly wrong, and maybe some guidance on how we could reframe those interactions, and some examples that are emerging of where social service agencies, street medicine programs are beginning to formally work with law enforcement. In summary, I think it's necessary for us to, in street medicine, to maintain our trust with the people on the street, and that does require somewhat of a outsider perspective, a kind of a Robin Hood perspective. But then it's our moral obligation to those and also to society to begin to bridge in love and respect to our brethren in law enforcement and in healthcare, so that we don't have to have these oppositional, unnatural, inhuman reactions with each other. I envision the street medicine movement growing and beginning to develop those partnerships locally, but I certainly welcome national level discussions on how we might work as organizations to better articulate that and structure those kinds of those healing, embracive, inclusive, and reality-based solutions. Thank you.
Thank you so much, Dr. Withers. We really appreciate your personal and institutional support of this effort. Okay, we are on schedule. We are going to now pivot to our workshop sessions. I am pretty sure my colleague Brandon has set them up. So at the bottom of your screen, you will find, at least on my screen, I have to click the button More with 3 dots on it in order to find breakout rooms. Double check that that's working properly.
Okay, they should be open now, Michael.